Let's start out by defining how errors are classified. CCHI divides their rating scales into 4 categories. The first being lexical content, the second, register of speech, the third, grammar, and finally, the fourth, quality of speech. What do each of these categories mean? Let's go through them one by one. First, we're going to discuss lexical content. When it comes to lexical content, it's important to understand how errors are classified, errors in general, throughout all 4 rating scales. To identify different errors, raters evaluate how accurately the candidate preserves units of information. So, what are units of information? Great question. Well, a unit of information can be something as small as an individual word. It could be a group of words or a phrase, something that communicates a single concept. Here's our first example. The sentence here is, the patient is stable after surgery. Take a look at this sentence and decide how many units of information you find. In this particular example, we have 2 units of information. The first unit of information is the patient is stable. The second unit of information is after surgery. Each of these can be defined by the appropriate grammatical label. The first being an independent clause, which can stand on its own, the patient is stable. And the second, starting with a preposition, would be classified as a prepositional phrase. You do not need to understand this to this degree, but it is important to be able to identify units of information in general to know how raters are going to be looking at the work that you produce during these certification exams and understand how they're going to be scoring them and what may cause you to lose points. In Spanish, if we were to take this same example, it would be el paciente está estable después de la cirugía. Similar to what we see in English, this would be divided into 2 units of information. So when doing the interpretation from English to Spanish, they would be grading you on these 2. Let's look at another example. Here we see, if the pain gets worse, you should go to the emergency room immediately. How many units of information do you see in this example? In this example, I've divided it into 3 units of information. Please note that on the CCHI exam itself, they may divide up units of information slightly differently. What I'm going off of here is my experience rating similar exams for a language service provider, as well as just training in interpreting. I do not rate exams for CCHI and created these examples on my own to provide you an idea and a foundation for understanding these concepts. So here, if I were creating the exam, I would have broken it up into 3 different units of information. Why would I have divided it up that way? Well, here I see 3 different important units of information. I see one dependent clause that starts with if the pain gets worse, it cannot stand on its own. We need to know more information. The second being an independent clause, you should go to the emergency room. And the third being an adverb, but that is clinically significant immediately. That is important information, so I put that in its own unit of information. As you can see here, we have the same example in Spanish, also broken up into 3 units of information. Si el dolor empeora, debe ir a la sala de emergencias inmediatamente. First, second, and third unit of information. Now that we know what units of information are, let's start to identify the different types of errors that can occur in the first category or rating scale, identified as lexical content. These errors include omissions, which is the most common type of error on interpreting exams. Omissions meaning that information gets left out or is simply not stated. Then we have additions, when information is added when it wasn't present in the original. And finally, we have inaccurate translations. We're going to go through examples of each and every one of these, starting with the first category, omissions. To access the full class and see examples of omissions, additions, inaccurate translations, and the other 3 rating skills on the CCHI exam, access the class link in the course description or comments.